An example of the things that we do here is a patient who came in with non-Hodgkin's lymphoma. He found out that he had the disease after going to the emergency room after a suicide attempt. So he came in here and he was joking, playful, and you wouldn't think that there was anything wrong with him. And one thing that we do here, that the social work intern does, is get to the bottom of the problem. His problem was his depression of dealing with this condition, and he didn't have anyone to express this to. He didn't have anyone to help him go through this problem. So by speaking with him and getting to the bottom of the problem, I think we were not just dealing with the pathology, but with the problem, with the emotions. And that's one thing that a social worker can do, and it's an important component of the clinic to get to the bottom of the emotional issues that our clients go through. So I was able to connect him with a psychologist who is giving him counseling free of charge. And that's one of the basic things. It's not just a condition, but getting to the root of the emotional well-being of the person. Social workers, we have a set of skills that we bring with us to help our patients and our clients. Whoever, if they're having an emotional problem, we have counseling skills to help them go through whatever they're going through. And most of all, we know how to navigate application process, how to navigate the paperwork for them, because many people, due to the language, due to the complexity of the applications, they're not able to access many of the programs that are out there in our community. And that's why social work is important, because we know the paperwork, we know the different things that you have to do in order to do an application correctly and not be turned down because you made a mistake on the application, which is something that happens so often with Medicaid and food stamps. So by offering that help and by navigating the application process, by navigating those things with them, we're helping them. Because many people, because they don't know how to fill out the application, they just think that, I'm not going to do it because I'm not going to be able to do it. So we walk them through it, and that's why social work is important. We walk our patients and our clients through, whether it is an issue, whether it is an application process, we walk them through it in order for them to achieve what they need to achieve. Well, I like helping people, and that's what I do for a living. And I feel that this clinic gives me the opportunity to help people at a really deep level, People that are struggling with their health, that's one of the worst things to go through in this country, because there is no access to healthcare for people who have low income. There is many loopholes for people who don't have legal immigration status in this country. They're left with nothing and nowhere to go to. So this is one of those places they can go to that would open their arms and help them when they have no one else to help. So I thought this was a great opportunity, and it's in our community. We're making a difference for people that have no one else to help. So that's why I came here, and that's why I think I'm making a difference in my community, and I wanted to be part of it.